Thank you for joining. Okay, thank you for joining us this afternoon for the Indoor Air Quality Ventilation webinar. My name is Tu, and I work with Public Health Seattle King County in the Environmental Health Division. And within that division is the COVID-19 Recovery Program, and our indoor air quality team lies underneath that program. And so at this time, I would like to introduce the technical assistance team and the presenter for this webinar. We have Rhoda Mohammed and Daniel Huang. And before we begin our presentation, I wanted to remind everyone that all child care facilities attending this webinar will receive a free HEPA air cleaner if you have never received a HEPA air cleaner from Public Health or Child Care Resources. But I will provide information about that at the end of this webinar. So at this time, we will begin.
Want to say something real quick before we start? It's Camila again.
Yes.
I also work for Public Health, and I'm the communications lead for the Environmental Health Recovery Program. And the people asking me if we are going to send the presentation, I have all the emails from the registration form, and yes, I can send the presentation later today or maybe tomorrow, but you will have it this week.
Okay, thank you, Camila. And so we're recording it, and we would have the recording available as well. So our agenda today is we want to be able to give you an overview and what our objective is for our team. We want to be able to talk to you about what indoor air quality is, why is it important, how does it work, and how can we improve it? And we'll kind of talk about some child care concerns that we see. And then we have a list of resources that we want to share with you that we think it would be helpful for your facility. And then at the end, we'll do questions and answers. But if you could also write in your questions on the chat box, and Lucy, she'll monitor that, but we will answer those questions at the end of the webinar. So today's objective is that we want to increase your awareness of the importance of healthy. We want you to be able to understand the different types of ventilation and how they affect the airflow in your building or space. And from that, we want you to be able to use your understanding to maximize the air quality in your childcare space. And so at this time, I would like to introduce Rhoda.
Hello everyone, today we are presenting to you why is indoor air quality is important. So the average person spends 87% of their time indoors before the pandemic, and since the pandemic that number has increased. So as we spend more time inside, we become more vulnerable to contaminants within the air, including COVID-19 and other viruses. Also with the new variants of COVID-19 continuing to bring new concerns and more recognized, we must recognize our indoor air as an important factor in our health. So good indoor air quality can help to reduce the airborne transmission of COVID-19 and other viruses. And now we have Omicron, and we are still learning about the Omicron variant. And we don't know how it spreads or infects individuals, as well as how it responds to vaccines. Next slide, yes. And children are not tiny adults, they are children, and particularly they are very vulnerable to poor indoor air quality, as their lungs are still developing until they reach 6 or 8 years old. So young children breathe more than adults. That means they breathe in more pollutants than adults if they are in a poor indoor air quality. So you can see this chart that infants until 1 year old, their birth rate is like 30 to 60, like toddlers 24 to 40 per minute. And preschool is like 22 to 34. So when they get older, that gets less and less. But when they are young, they breathe much more than the adults. Next slide, please. Next slide, please. Hello. This is the multiple layers of protection, and we need the multiple layers of protection to block the spread of COVID-19. We can see that all these layers have holes, and when these holes align, the risk of infection increases. But when several layers combine, for example, in social distancing, hand washing, wearing masks, getting vaccinated will significantly reduce the overall risk. However, indoor air is a shared responsibility, so we need to act together to protect one another. Next slide, please. How do viral particles spread? They spread when you cough, if you have the virus, when you cough, when you talk or breathe or sneeze, that's how much particles you produce. So if you have COVID-19, and that's how much droplets and particles that contain viral COVID-19 you can produce when you cough or sneeze. And these droplets and particles can be inhaled by other people or land on their eyes or noses. And at the same time, they may contaminate surfaces that other people touch. And also people who are closer to that person, they are most likely to get infected. Viral particles in the air, think of every person as a potential source of the virus. Particles come out of our mouths and noses and circulate as droplets or particles in the air. So we are trying to prevent the particles from being in the air by wearing masks. We are trying to dilute the particles in the air by opening the windows or doors and bring more fresh air in. And by filtering our indoor air by using HVAC system or portable air cleaners. Next slide, please. Next slide. Airborne transmission. Masks reduce airborne transmission. So when you wear mask, you are controlling the source and protecting others, and also reducing the spread of the large respiratory droplets to others, and you are also controlling that particles to circulate in the air. So the particles and aerosols that is generated by this person, maybe if he has COVID, then the other person who is standing in front of him will inhale that. And basically that person will get infected with the virus. But if you are far away from the person, still the particles are circulating in the air, but you have less chance to get the COVID. Next slide, please. So prevent particles from being in the air. If you wear masks, mask contains 20 to 60% of droplets coming from mouth and nose. So regularly check and ensure children have masks that fit correctly, as they can grow out of them quickly. So COVID and other viruses are airborne respiratory viruses that we get infected from inhaling large enough dose. But if you wear masks, it can control that. And also when you wear masks, any droplets or particles you produce do not become circulating aerosols. Also limit time people use a room or space if you can. This will decrease the number of particles that will accumulate in the space. due to people being in that space. So if you can go outside a short period of time, you will let the room flush, then open the windows and doors or turn on if you have a HEPA air cleaner, and that will give the room a chance to change the air. Next slide, please. So ventilation and filtration. Ventilation is when you bring a fresh air in by opening windows and doors, and that will dilute any particles or droplets that is circulating in the air. And filtration is capturing and removing particles from the air by using filters like HVAC system or air cleaners. So you can see this picture, the air that's containing fire particles is going through the picture, then fresh air will come out. But if you inhale this air that's containing the virus, probably you will get infected. Next slide, please. Natural ventilation. So it's always better to open the window is wide, but if you crack a little bit and open it slightly, it will help to dilute any contaminants in the air. So open the windows and doors if the weather permits or if it is safe to do it. So fans in a window to blow will blow potentially contaminated air out and bring fresh air through other opening windows. So use child-safe fans to increase the effectiveness of open air. Safely secure fans if you use fans in a window to blow any contaminated air out. And keep children separated as much as possible. And help children that are 2 years old or older wear masks, but masks are not worn during the nap and rest time. And also when if you have a daycare, if you are cleaning the daycare, don't clean when the children are in the daycare, or don't vacuum it because children, they breathe more than us, so they will inhale. If you are using chemicals to clean your daycare, they will inhale all that chemicals. So please don't clean it when the children are in the daycare, or do not vacuum it. Next slide, please. So airborne transmission and natural ventilation. So this picture, you can see this person, for example, has the COVID and he's producing all these particles and he's not wearing mask. So the other person also is not wearing mask, and the particles, a lot of viral particles are circulating in the air. But when you open the windows, that the contaminated air will go out and fresh air will come in. And you can see this area, because the fresh air is coming in, you can see that the air is got diluted and the particles are getting less. So this person will have less chance to get infected from the other person. Next slide, please. Next slide. And now Daniel will talk about mechanical ventilation.
Hi, so another source of ventilation would be mechanical, and examples would be your local exhaust, your bathroom fans, kitchen hoods, and whenever they are, they should be running whenever the building's occupied. What this does is that it pulls the air inside your facility and it pushes out. So for example, when you're taking a shower, you know how steamy it gets. The reason why we have that fan is actually to control our humidity, and in general, just to help to push that air out. Next slide, please. This right here is a basic schematic of how a duct system is. As you can see, that typically the duct system includes air handling unit on top, and from inside the roof, it actually brings in outside air and it conditions it and it spreads it inside your facility, and at the same time it distributes it around. And most buildings actually have recirculated air, and this, the only reason why is just for energy efficiency, for lowering costs. Next slide, please. Your HVAC system, if you have one, is the most reliable way to move air. HVAC system is heating, ventilation, and air conditioning system is compromised with one or more air handling units that pull air in from the outside and circulate your air through the building. So if you can see, if you're technically doing your daycare inside your house, you'll see some ducts, which we'll show later on through the slides. Technically, that would be bringing in fresh air. Next slide, please. Outside air intake is important for diluting air. The reason why is that it helps bring in fresh outdoor air and helps dilute the indoor air. And this helps filter the circulating air and it's important to remove particles in the air. Maintain the system, clean, replace filters, and make sure they are properly seated. Next slide, please. So here are pictures. The one to your left is the supply air duct. This is where it's actually bringing in fresh outdoor air. And then to the right is going to be a return air duct. You can generally see these in the center of your building. And what I mean by center of your building, so for example, in my house, it's going to be in the middle of the house. So if you're going to look for return air duct, it's usually in the central area of your building. So where do you want to start? You want to see if your supply diffuser are blocked. Sometimes they are blocked, and you can see if it's closed off. So you would like to open it, and that will help bring air in. And if they're dirty, I would recommend to vacuum and either clean it. You can clean it and dry it, but just be careful about the moisture control because you don't want mold to grow on it. And next slide, please. And this is where you can also detect. You can use the tissue test. So what you can do is grab a piece of tissue and then put it in your supply air duct and see if the air is sucking in or pushing out. If it's pushing out, then it's supplying your air. And if it's sucking in, that's your return air. So here's some easy ways to increase ventilation. You can open your window, but be careful of the air currents that you may create. The reason why I say this is that when you do certain parts of your building in your house and it's like opening a car, you have your passenger driver side open and then you have your rear side open and it just creates this angle, bi-cross angle. So you want to be careful how you open your windows within your facility. Next slide, please. See. So if you actually have an air handling unit, so an AC unit, you want to see if you can actually increase the airflow with that unit itself. And some of these systems actually rely on temperature control to activate for timer. So you would like to adjust this either by turning off the demand control setting, and will provide more air changes and better dilution of the space. And modification can be helped by either by your maintenance or HVAC engineer. Next slide, please. And this is one way that we recommend. Consider a portable HEPA filter. These are really good for using as source control, and they can be sized up to your room and should be placed in your breathing air zone. Next slide, please. So here's a demonstration of the filters that we'll be giving. There will be a pre-filter, and then after the pre-filter is the carbon filter. This helps with odors and allergens, and then the true HEPA filter. This filter itself has the capability to capture the COVID-19 particles. Next slide, please. So here you can see a demonstration with the purifier itself. It's able to suck in the dilution of the air particles, particulate matter as small as COVID-19, and helps dilute the air. And as during this process, it helps and add another layer of protection in your indoor facility. All right, next slide. So where would you like to place these? You want to place these where the most common areas are used. So spending the most time, where do children take naps in different areas? Where do they play? Where will it help you out the most? Are there areas that are stagnant? So an example would be a place that you can't open windows or doors. Are there spaces that you can't turn your exhaust fans? Where are the outlets? And is there enough space so that you can keep this 12 inches away from the wall and other electronics? And where can you put it safely amongst children? Okay, next slide, please. So this is a demonstration about barriers itself. We are recommending to stop using barriers as plexiglasses. As you can see that though it may protect one person, it actually entraps the air particles at the other side, which is this doesn't help dilute the air. So we recommend not to use plexiglass barriers anymore. As you can see that if it does, and you open your windows with its natural source ventilation, you can see the right side of the room is being very diluted, but it's still trapped on the left side because of the barrier. And then, next slide. So our objectives here was to increase awareness of indoor air quality issues and managing how to manage it. Identify, reduce language, financial and other resource barriers to increase indoor air quality, to reduce COVID-19 transmission, and to support your needs in other sectors as well, concerning indoor air quality and COVID transmission. Next slide. I'll hand it off to Tu.
Daniel, and thank you, Rhoda. So here are some resources that could be helpful for your facility. This is a YouTube that you can watch to learn more about transmission in your respiratory system. And King County has a very good website that talks about how to improve your indoor air. And so it's got more detailed information than what we presented to you today. And this website here, if you're looking to get a HEPA air cleaner, it lists the approvable air cleaners that are out there that are been approved by a third party. And here is a do-it-yourself video on how to build a box filter fan. And so these are resources that are available for you, and we can provide if you want that. And the additional resources. The other thing is this is for the latest guidance that we have from Washington State Department of Health on childcare guidance. And so you can go there to get more information about the latest guidance. What else? And you have any questions, this is our email, iaqinfo@kingcounty.gov, or you can contact myself at thu.bui@kingcounty.gov. And also, if you don't remember any of those emails, you can also contact your child care coaches, and they can reach out to our team as well. So before we go on to our question and answer session, your child care coach is providing us a list of all the childcare facilities that are receiving a free HEPA air cleaner. So from that list, Public Health will use that email and email you the detailed information on when and where to pick up your free HEPA air cleaner. But please note that if you already received your free HEPA air cleaner from either Public Health or from Child Care Resources, you don't qualify since you've already received your free one already. And when you go to pick up your free HEPA air cleaner, if you do a site assessment with our technical assistance team, then you can be eligible for additional free HEPA air cleaner. So when you go to the pickup event that we have, that's going to be held on February 19th from 10 to 1. If it would be helpful if you bring a square footage of your space that is in your facility, because we use that information to determine how many more HEPA air cleaner that you're eligible for. Anything else? So at this time, Lucy, if there are any questions in the chat box, or if there is questions that you have, feel free to ask it at this time.
Thank you. We did get a few questions in the chat, so I'll go through those first, and then I'll invite folks to chime in with any other questions they have. So the first one is from Elizabeth Kawaka. Are the HEPA filters all the same size, or are there smaller sizes?
No, they're all the same size. And I can get that information too, but it's almost the size of a paper shredder.
And this question, I think, was early on in the call, so I'm not sure if their question was kind of more generally what HEPA units are available that you can purchase, or but the ones that public health is giving out are all the same size.
Yeah, so this website here that I have, it's a website that you can go in there, and they're a third party that looks at different types of HEPA machines out there. And so those are the ones that we recommend for you to look on and to see what air cleaners are qualified, and they're safe and they're energy efficient. But the one that we're giving out, they're all the same. And I can't put the dimension, they're almost the size of a paper shredder. And you can move these HEPA cleaners around in different rooms, depending on where if you have a meeting, for example, you can bring that in there and it'll help to clean the air. And then you can move it to a different room.
Thank you. All right, so we have another question from Pagan. So what are the correct ways to increase proper airflow with windows? Which windows should be opened?
That would depend on your facility. This is where we would do a site assessment. So if you show us your layout, that's where we'll make the assessment.
And
No, so
I also,
it's better to open like 2 windows in the same room, so fresh air will come in and the polluted air will go out. But even if you have only 1 window, you can open that and that will dilute it, but it's better to open 2.
yeah, and just imagine it's like a water flow. Water has to come out from somewhere and it has to flow somewhere. So if you can get that flow going, then it helps to move clean air in and dilute it and bring the dirty air out. And the other thing I wanted to mention is that even if you've already received your free HEPA air cleaner, you can still contact us and we can still come out and do an assessment at your facility just to help you better understand about your ventilation and where you can place your HEPA unit, or about opening windows, that sort of thing. So you can still contact us for more educational information if you like.
Great, thank you. All right, so a question from Amruta. And for this question, I'm gonna call in our folks from the Child Care Health Program who might be on the call. So Muna, Viviana, I'm giving you a heads up. Do portable HEPA filters need special installation waivers through DCYF? I was told we cannot have any wires or electronics in children's reach.
You can go back and ask our team. That is a licensing question, so I would say connect with your licensor about that. But we can go back and ask our team and get back to you. Is that okay, Lucy?
Sounds great. Thank you, Muna.
No problem.
All right, and then a comment from Rita. In my center, there's HVAC system and windows don't open. Any suggestions from our presenters on that situation?
Okay, I'll answer that one. If you cannot, the thing is, you want to check with your maintenance person about your HVAC. Sometimes if the HVAC is on, they may not want you to open the windows because it may disrupt the HVAC system. So you want to check with your maintenance person to see if you can do that, to make sure that there's no disruption with the HVAC system. Does that make sense?
Rita clarified in the chat. So in this case, they're not able to open any windows in the office building. The windows are sealed.
Yeah, and that's when your HVAC system would come in place. And that's the other thing, is that if you can't open the windows, but your HVAC system may be limited in helping move the air, that's where your HEPA unit would be helpful. So that's where you want to place it, is where you think that there's no or low air movement. So if there's an HVAC system in one corner and then on the other across from that, you might feel that there's not much air movement in there. And that's where we would utilize the HEPA air cleaner. And that's what we talk about, is where do you place it? So you place it where there's no airflow or low airflow.
Great, thank you. All right, and then another question around windows. Lamarck said you showed an up and down window with the top and bottom open. Which is best? I'm using upper about 4 inches.
Sorry, can you read that?
Yeah, I can read it again. Or whoever wrote in the question can chime in. They said, you showed an up and down window with the top and bottom open. Which is best? I'm using an upper about 4 inches.
So is it coming down? Is that what that person means?
Well, Mark, are you still here for the call? Do you want to chime in? If not, maybe we can move into the next question. If there's further clarifications, please pop it in the chat. And then just a quick reminder for those of you who joined a little bit later and you haven't done this already, please put your name and your STARS ID in the chat to make sure that you receive your STARS credit for attending this training. Let me just go through and see what other questions we have here. Let's see. So a lot of questions around the pickup date, and if there's only one HEPA filter, irrespective of the size of the center. So again, the pickup date is going to be on February 19th. You will receive details once we verify eligibility. And right now we are giving just one HEPA per site. And again, there's TU's team will be there to do an assessment to see if you would be eligible for more. And then for those who are not able to make that date and time, I think we can work out a delivery schedule. Is that right, Tu?
Yeah, so when we receive a list, an email list from the child care group, then we will email details on where and when to pick up your HEPA unit. And it is located in Kent, and I don't have the address exactly, but it's in Kent. It's at our Kent warehouse on a Saturday from 10 to 1. And if you're not able to come to that event, you can respond back to us or email me and let me know, you're not able to attend it, and I can make arrangements with you, or I can email you our next scheduled pickup event. But yes, if you are qualified for your free HEPA unit and you're interested in getting additional ones, we can do a technical assistance assessment when you come to the pickup event, and that way you could be eligible for more than one HEPA unit. We want to be able to help you and reduce any transmission or diseases at your workplace. So we try to work with you and help as much as we can.
Great, thank you.
Any other questions?
I do see a couple more questions in the chat, again, about qualifying for the air purifier. If you're not in King County, unfortunately, you are not eligible to receive an air purifier. And this is due to constraints about from our funding source. So I'm sorry about that. Let's see, I think,
I have a quick question.
yeah, go for it.
So we have one of our air filters, we had it in a specific area by the door, and then we had to move it because we're limited to space. So one of our teams decided that they were going to put it right next to the heat ventilator. And because it's winter, the heat's on, and then this air purifier is also blowing, and I kind of moved it because I thought it didn't make good practice. But I'm going off of what I thought. It's not something that's actually a professional opinion. And so my question is, should your air purifier not be near a heat source? Or does it matter? If the heat is on.
I wouldn't put it near a heat source because that puts additional stress onto the machine, and then you're also melting. There's possible that you can melt it as well too. I would put it somewhere that's common. So an example is if you have a daycare, like your play area, that'd be a great place to put your purifier, but not near a heat source.
Thank you.
Yeah, and just be careful where you place it, just because sometimes kids can get into it. And what we've done or have recommended is maybe have it somewhere where you build a shelf kind of above where they can touch it and then secure against the wall. But again, you would have to check with your license, or who licensed you, if that's approvable.
Okay, thanks. I guess a quick follow-up to that then, one of you mentioned being able to come out on site and seeing, like, I missed a little piece of it, assessing coming in to your site to facility to see if where things are placed is appropriate. Is that, and just contacting you all, is there a specific email that we should contact, or is it like, does it matter? Like, I'm seeing it on your slide, but I was wondering if it could also, are we going to have access to the slide so then I can get it from there, or will it be put in the chat?
There's a variety of ways. So you have my email there, and then we have a generic indoor air quality, but you can always email me and request for that. And then I think Nayeli and Lucy, they have access to our slides. So they can provide that information as well.
Thank you. Thank you.
Yep. So my email is thu.bui@kingcounty.gov if you're looking for that service.
Thank you.
Mm-hmm.
Thank
I
you.
have a question.
Go for it.
Hello?
Yeah, go for it.
Hi.
Yeah. So did you say you can come in and check where we can put the air filter? Did you say you can come in, or do we need
Yes.
to email you first before you can come in?
If you email me and let me know who you are, make arrangements when we can stop by your facility to, provide assessment.
Okay.
So my email there, do you see that? thu.bui@kingcounty.gov. You can email me with your information, and then I can assign an investigator to come out to help out where you can place your HEPA unit, and so yeah.
So what is your email again? THU?
THU.B as in boy, UI,
Okay.
at kingcounty.gov.
All right. Thank you.
Mm-hmm.
So we would need to do this prior to the 19th of February?
No, you can do it now or later. But I mean, it would be good if you did it now. That way we can kind of figure out how many you could qualify for. So when you come to the pickup event, you can pick up more than one if you're eligible for it.
Okay, and if we qualified for 2, air filters in the last event when we went to the warehouse, but only received one. Do we still qualify for that?
Yeah, I think you would. So depending on your space. So if your space requires another HEPA unit, then we would be happy to give you another one. Because the machine, the HEPA unit that we have covers up to 360 square feet. So if your space is bigger than that, you would probably want another unit, so that way you can get the full 4 to 6 air exchange.
Okay, okay. Thank you.
Yeah. Any other questions?
Sorry,
Yeah.
how many feet do you say?
360 square feet.
360 square
So
feet.
that's why, yeah. So when you event, it's helpful to have square footage of the space that you're using for your daycare facility.
Oh, okay. Thank you.
Hi. Yeah, I have one more question. Is
Hi.
it an email to send if you can't come on the 19th to pick it up? Do we send you email too?
No, childcare facility or childcare resources, they have a list of who you are, and they're going to verify to make sure that you already received your HEPA unit or not. And then if you haven't, then they'll give us that list, and then from that list we will send to you on when and where to pick it up. So if you haven't received a HEPA unit from either public health or childcare resources, then you would be eligible to receive those units.
Okay. So when you get that information, that's when I would be able to, I will know where I have to pick it up.
Yeah, we'll send you the information once we get your email from childcare resources. So with that email, we will send you the location and the exact date. I mean, February 19th is a date, and we'll send you the exact address and all that.
Okay, thank you.
Yeah, and again, if you can't make it, you can email me and let me know, and I can make arrangements with you, or I will send you a schedule of our next pickup.
Okay, so that means if I can't make it on the 19th, when do I
Yes.
send?
Oh, anytime. Yeah, just let me know ahead of time. That's fine. Or even after, if you don't make it on after February 19th, yeah, just email me and say, hey, I didn't make it, for whatever reason, and then I'll send you the details on when and where you can pick it up.
Okay, thank you.
Mhm.
Hi.
Sorry, can I ask
Hello?
questions in the chat first before we go to Saida? Just give me 1 second. So one clarification for the person who had questions about having wires or electronics in children's reach. We did get an answer from one of the nurses in the child care health program. They said that they would just use wire covers for the cords, and then you should be okay. And then a couple other questions about eligibility for the HEPA units. You do not need to be a licensed childcare to qualify for the HEPA unit. You do need to be a childcare provider within King County. So that means if you're, family, friend, and neighbor caregiver, you are still eligible to receive a HEPA air purifier.
Hi. So my question is, like, if I have two different rooms, like I'm using for the childcare, so do I need two HEPA purifier?
We would recommend, if you have both spaces that are being used at the same time, then we would recommend to have 2 different units. But if you use one room one time, and then when that's done, you go to the next room, you could just get away with one machine, because you can relocate the machine to a different room.
Oh,
But it
okay.
sounds like you may need two for both rooms.
Yes. Okay. All right. Thank you.
Hi, I had a question, if that's okay.
Yes.
We are a church and we provide childcare during our services and classes as well. So do we qualify still?
Yeah, so we also provide HEPA units to faith-based organizations. And you can sign up. Are you part of the childcare resource group or?
Yeah, I'm kind of like the church representative, so
Okay.
represent almost a lot of stuff.
Okay. What you could also do is when you come pick up your free HEPA cleaner on the 19th, bring information about your faith-based organizations and services. So like, the name of it, who's in charge, and then also the space that you use for that service. And then we could also provide HEPA units for that sector as well. So we work with faith-based organization sectors as well as childcare.
Okay, great. Thank you so much.
Yeah. Yeah. Any other questions? So if there are no questions, then I think we will end it. But I just wanted to say thank
Hi.
you to Lucy. Oh, is somebody
Hi.
else there?
Yeah,
Uh-huh.
sorry. I was just asking if, what about if there are two different locations for two different schools and maybe each location has like two classrooms, like a toddler and a preschool? Will we still qualify for just one or filter as a school organization, as a per location or per classroom, or how will that work? We are within King County.
Okay. So you would qualify for one HEPA unit per location. Hello? So you would qualify for one HEPA for each location. And when you do an assessment, we talk about one facility first. And then we talk about how many space you have there. And if you qualify for more, if your space is more than 360 square feet, then we could give you additional one for that location. And then we'll move on to your second location. We'll talk about that. And then we'll talk about how many HEPA units that you could qualify for that location.
Okay, is it okay if I email you this information?
You can email it to me, but I would route it back to your child care coach to verify that if you are part of that list. But yeah, you can email me and I'll follow up with you on the two locations that you're talking about.
Yes, totally. I can also include the coach in the same email if
Okay.
it makes it easier.
Yeah, we want to make it easy for you so that you can get the HEPA units that you need to be able to operate your childcare facility safely. So yes.
Mm-hmm. Thank you.
So I do see one more question from Susan Johns, confirming we would need to bring square footage of our facility to determine if we qualify for additional units. Is this total square feet, or is the square feet of each classroom / common area?
So square footage of the space, maybe the classroom you're using. So for each room. So that way we know there's 5 classrooms, for example, and each of those classroom are this big. So that way we can kind of see like, oh, well, each classroom may need one HEPA unit at least. And then if one classroom is bigger than another one, we might consider giving you an additional one for that bigger classroom. So if you can give us square footage for each classroom, it would be helpful. But if you're not able to do that, that's fine too. We try to work with you when you're there, but it's always helpful to have that square footage available.
Okay, I have one more question. So you said
yes.
Is Pierce County, if you are in Pierce County, can you also receive this?
I'm sorry, can you repeat that?
I said if you are in Pierce County, are you included?
I believe we're only, the only providers who are eligible have to be in King County due to our funding stream. Too, you can correct me if I'm wrong. I have reached out to folks in environmental health in Pierce County to see what kind of resources they can gather up around this. And then I have let them know that it is a big need for providers to receive HEPA air purifiers. So finger crossed that they're finding some funding for that soon.
So Pierce County is not included?
No.
No.
Unfortunately.
But I got the email to attend this meeting, so that's why I thought I was, because I'm in Pierce County, so I thought I was going to get it. Because I got an email to attend this meeting.
Yeah, I'm sorry for the confusion. So we did want to reach out to everyone to make sure they at least had access to this information about indoor air quality and ventilation. But unfortunately, the HEPA air purifiers are only for those in King County.
Oh, I didn't know that.
And the registration, this is Camila, then the registration where you go and register for this event, it says there's information there that says that the school childcare needs to be in King County.
Okay.
Yeah, our funding can't, the requirement is for only within King County, so we can't change that requirement.
Okay, I got the wrong information. Okay. So, so I won't get this because I'm in Pierce County.
What you could do is, yeah, we can't give you a free one, but you can go to this website here.
Mm-hmm.
And that will give you a list of some of the potential ones that you could purchase on your own. And those are the ones that we recommend that are approved by third-party vendors.
Okay. So which one?
This
Which
website
website?
here, you see that?
Oh, this. Okay. Yeah.
It's the AHAM. Yeah.
Okay. All right. Thank you.
Yeah.
You know, and if anything, this gives us the opportunity to be able to reach out to our local resources here, using you guys as an example of what you guys are doing for King County. So thank you very much for even having this amount from Walla Walla County. So I definitely am not going to qualify for this, but something that I will pursue within our local resources. And that's something that I hope everybody else will voice as well.
Yeah, we want to be able to provide it to everybody, but just because of the funding requirements that we have, you know, that's kind of the restriction that we're under. But hopefully you're able to get some of the educational information from this and be able to improve your own space in other ways.
And
if there are no more, is there any more questions?
Yeah, just to reiterate, once you guys cross-reference the attendance for today and sites, that's when you guys will be reaching out to us regarding the air filtration.
Yeah, so the child care resource will be they'll send us a list of all the facilities that qualify for a free HEPA cleaner, and then we'll send you direct information on to pick up your HEPA unit. And then when you get to the pickup event, if you do an assessment with us, you could qualify for more than one unit. And if you can't pick it up, you can email me and let me know, and then we can make other arrangements.
Got it. Thanks.
Okay.
Just to add, it might be probably mid next week before you get the email, because we do have to verify the attendees versus the registration and then eligibility. So just give us a little bit of time to get back to you all. And the email should be coming from someone named Terrace Mayers at King County. So I know we're right at time, 2:30. So I want to thank all our presenters here today and all of you for joining this meeting, and hopefully you learned something that you can apply to your childcare setting. Again, we'll be sending out slides and the recording via email to all of those who registered. And yeah, thank you again for being here today.
Yeah, thank you, Lucy and Nayeli and Nadia for coordinating this webinar with King County Public Health. And thank you for joining us today.
Thank you.
Thank you very much, everybody. Thank you.
Thank you very much. I really appreciate all your help.